So let's talk about how to get an urgent hospital appointment. So maybe you've been seen by your GP and you've been referred to a hospital specialist for symptoms such as nausea, abdominal cramps, bloating, diarrhea. You're worried about stomach cancer, your GP is not worried, he's referred you routinely, and your appointment time, you're told you might have to wait 18 weeks to get an appointment. You're obviously quite concerned, you're anxious, you're having sleepless nights, could it be stomach cancer, and you're being seen by the NHS GP and you cannot afford to go private. And ideally, you would like to be seen as soon as possible by the hospital specialist. So what do? Well, there are different options. One of your options is to go back to your GP and let your GP know that you're quite anxious and you would like to be seen urgently. Remember, your GP is your advocate. Your GP is acting on behalf of you as his or her patient. So what your GP would usually do is, in addition to the previous referral that they had written, which might have been weeks ago, your GP can write another letter stating in capitals, "Can you please see Mr. or Mrs. XX urgently, as she has these sort of symptoms which is causing anxiety and she is worried about stomach cancer." So that's the kind of letter that your GP can write back to the specialist requesting to be seen urgently. Now, when the specialist receives that letter, it is up to the specialist to decide whether to bring forward your appointment time. So what could be 18 weeks could now be 6 weeks, which is much better waiting time. And that is one way that your GP can help you in being seen urgently by the hospital specialist. A second way is, once you've got your appointment date, which is 18 weeks away, or you might be put on a waiting list for any other problem, you can call the appointment number, because usually on the letter, which acknowledges that you've been referred by your GP, there's usually an appointment number on that letter, and you can call them. There are different ways. You can either choose to call them every day in the hope that there will be a cancellation, or in some cases, the appointments team would say, look, we're going to put your name on the waiting list so that if there is any cancellation from any other patients, you'll be one of the first people that will get their appointment. So that's another method. Then the third method would be, if you know the department you're being referred to, so for like stomach cancer, it might be the gastroenterology department, or if you had a knee problem, it might be the orthopedic department. If you had a heart problem, it might be the cardiology department. What you can do is you can go through the hospital switchboard, ask for the secretary. So you might not know the consultant that you've been referred to, so you can ask for the secretary of any consultant, give them your name, and in most cases they might be able to trace the consultant that you're most likely to be seen by. If you don't have an allocated consultant yet, what the secretary can do is write your name down and say, look, we don't have any appointments at present, or we would speak to your consultant if this appointment can be brought forward because of the concerns that you have mentioned. So these are the three ways by which you can get a more urgent hospital appointment with your specialist. 1, getting your GP to write a letter classed as urgent to the hospital specialist. 2, calling the appointments line, maybe on a daily basis, or they'll put your name on the waiting list for when a cancellation comes through. Number 3, calling the secretary of the referred consultant that you have been referred to see if there's any way they can push your appointment forward. What I would advise you to not do is maybe try and hound them or be rude or be disrespectful, because that's not going to help your case. Because, don't forget, even the staff that you're speaking to have been patients too. We've all been patients, we know the process, we've all been in the process of the NHS. The NHS is a free service that we're all grateful for. Some patients can afford to go privately if they're not able to be seen under those waiting times of the NHS. But for those who cannot afford to go privately, unfortunately, this is the system they have to use, and it is a waiting game at the end of the day. I hope you enjoyed this video. Please, you can also check out my video on how to get a same-day urgent appointment with your GP.